I'm joined by Alan Saint, Director of Process Improvement at Providence. Alan is participating in the upcoming healthXchange Revenue Cycle AI, Automation, and Analytics meeting taking place on Tuesday, May 21st, where he'll be speaking with others about identifying and measuring key performance indicators and return on investment from revenue cycle technology projects. Alan, thanks so much for joining us today. Could you provide a brief overview of your professional journey thus far, including a bit about your current role and responsibilities at Providence?
So my professional journey has spanned different areas within healthcare, health plans, integrated delivery systems, large health systems throughout the United States, as well as consulting. My focus has really been centered around compliance, process improvement, and operations management. Currently, my role is Director of Process Improvement at Providence Health and Services, where our team really focuses in on honing processes from the entire revenue cycle. So from pre-registration all the way through billing collections, we look at areas that we can implement artificial intelligence and machine learning and any other emerging technology to improve patient health outcomes as well as patient experience, and really make our workflows more efficient, and also has the flip side of increasing revenue at times. So that's always good.
Absolutely, and I think that it must be a really exciting role and really interesting because there are just so many different processes when you think about the end-to-end patient experience and the revenue cycle, so much complexity and so many opportunities for streamlining processes and improving those workflows. When you think about emerging trends, what do you anticipate enhancing these workflows or disrupting the revenue cycle entirely as we look to the future?
Yeah, so again, artificial intelligence, AI is all the rave, and healthcare is one industry that seems to be catching up with the times with technology. A lot of times, healthcare is a little bit behind as far as tech, but they've really started to embrace it. And I think it really points to the amount of data that's available for these tech tools to really leverage. And so, of course, the future is going to be a lot of really eliminating a lot of manual labor tasks, and not total elimination, but really eliminating a lot of the background and research needed. So when you think of large language models and large data sets, healthcare is really ripe for that. When we look at the revenue cycle side, of course, very data heavy. So we can use generative AI and predictive AI in that specific domain. And I think a lot of what we're going to see in the future is interaction with patients. So really allowing them to take control of their health outcomes, and interaction with their health systems, especially on the revenue cycle side of just being more present in their healthcare. And so looking even further into the future, there's a lot of struggle with tech adoption for a certain subset of Americans. So when we look 15, 20 years down the road, I think we'll see a lot larger adoption as our Gen Zers get older and millennials get older as well. Technology is really going to be ingrained in their lives since birth. So I think there's a bright future, and health systems just need to stay cognizant of the impact that AI is going to have, especially on the patient experience, and then even looking on a larger spectrum, environmental impact. So data centers use a ton of electricity. So how are we going to balance those two? And then, of course, it's a bit of the Wild West in AI right now. So I think I would suggest colleagues be aware of pending regulations that will come, and so how to adapt those into their day-to-day operations and future projects to integrate AI is going to be essential for success.
Well, so many terrific points here, and I think that as you say, it's just such an exciting time with so much change, and it's really a great time to be in this industry. One of the aspects that we'll be talking about at the upcoming meeting is identifying benchmarks and KPIs that help to measure the impact of your technology investments. When you think about this subject, what would your advice be to fellow peers and colleagues in the industry that are thinking about what should I measure, how should I measure it, and how can I really, make a dollar amount that this technology is having as an impact?
Yeah, so that's a great question. And I think leaders need to be agile in what they're measuring. And of course, when a new technology is developed and implemented, your KPIs and benchmarks should adapt to that as well. And so immediately when we think of what AI and machine learning can do, we look at efficiency. So identifying which processes were under a different workflow prior to implementation of that tech. We need to look at how much efficiency are we getting based on what we've invested. So what is the ROI of that? I think another great KPI and benchmark to look at is of course patient satisfaction. So are patients adopting this? Are they enjoying this new technology if they're interacting with it? It's crucial to maintain happy patients and ensuring that they're able to adopt this new technology. And of course, when you look at the revenue side, a lot of these interventions take a lot of investment, not only investment in implementing the tech, but also investment in retraining employees, ensuring that leaders are prepared. So the project planning is also a very large investment. And so when we look at revenues on the backside after implementation, we need to look at the entire spectrum of what we're investing, as well as any future impacts that we're having on the organization. Is this truly the correct decision we need to go, the correct road we need to go down in order to be a successful increase revenues, but also ensure that the impact on patients is going to be positive.
Well, and I think that, the best part of, your take on this is that it should also really focus on improving that patient satisfaction and the patient experience. That's such an important factor that we have to kind of keep front of mind.
Absolutely. Yeah. And patients are everything. So if they're not happy, healthcare has to maintain that human touch. And as fast as AI is advancing, we really need to hold that close to ourselves to ensure that patients already could feel like they're just another statistic in the system, and we need to ensure that we're not making them feel like that even more, but harnessing those tools to really bridge those gaps.
Really appreciate you coming on this morning and sharing a bit about your background with us and in your great perspective on everything related to revenue cycle technology. And we really look forward to the meeting coming up later in May.